Welcome to Stand Up for Doctors. I'm your host, 𝗵𝗲𝗹𝗁. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And I would like to welcome Dr. Athena Hall and Heather Buesseler. Thanks for joining us today, Athena and Heather.
Yeah, thank you so much.
You're welcome. And by way of introduction, Dr. Athena Hall is a healthcare transformation leader and speaker and founder of 𝗁𝗂, collaborating to innovate and make the world healthier together, which of course I love that. And also Heather Buesseler's work focuses on rehumanizing health systems with an emphasis on compassion, flourishing, and human-centered design. So right away you can see the areas of synergy. And today we'll be talking about how I came to know of each of you through HRC, but you haven't met each other yet. And we had individual conversations. And I just would love for you to share what you're each doing to rehumanize and transform healthcare. So I would like to ask each of you what you'd like our audience most to know about you as we get started. Athena, would you like to go first?
Sure. Yeah, so I am a pediatrician. I live in Seattle, and I'm really passionate about health equity and ensuring that we're listening to what our communities need. I feel that a lot of people are struggling to sort out how do we fix our healthcare system. And I don't think that our system can necessarily be fixed. I think that we need to create something new, and that requires us listening to our communities and responding to their needs. So I feel that that's the future of our healthcare system, and that will take us all working together.
Yeah, absolutely. Yeah, thank you for sharing that. And I think I had just shared in my last episode for people that weren't aware is HRC talks about the two loops model and how any system, rises, peaks, and then falls or collapses, and then something new emerges. But in the case of healthcare, we need a bridge. Like we can't let it collapse, right? That would be so catastrophic. So I think that's what we're all trying to figure out is we all know it's not working now. So what can we do to move it to something that's sustainable for everyone? So I appreciate what you're doing very much. So Heather, what would you like us to know about you?
Thanks so much for bringing us together, Kim. I like to start from a really human place to introduce myself, and typically in building relationships with people. So I don't like to start necessarily with my work hat, my professional hat on. So I'll start just by saying that I'm a mother of a precocious 9-year-old daughter. I grew up in rural Minnesota, west central Minnesota. But I've traveled all over the world in some of the world's most far-flung places. Um, I also am a lover of nature, and it's a place that I find nourishment and respite to continue doing my work and showing up for the people that I love in my life. And then finally, I am a public health professional, and I founded my consulting firm, 𝗵𝗲𝗹𝗁, about 5 years ago in order to build more compassion and connection in health systems around the world.
That's terrific. So you both have a love of nature. That's correct, right? Yeah.
Absolutely. I love being outside. Yeah.
Yeah, yeah. Well, that's awesome. So Heather, you recently returned from a trip to Dublin. Is that correct?
That is correct, yes.
Would you like to tell us about, because we've been to Ireland twice. We spent 2 weeks there last fall and some time in Dublin, and we have some great friends in Kildare now. The Morris family, who I've had on, Olivia David Morris. So would you like to tell us about how that intersects with what we're talking about today?
Oh, sure, absolutely. So I was in Dublin to facilitate a workshop of a group of global palliative care providers. They come from all over the world. They represent different networks and professionals who are providing palliative care um, primarily in lower middle income countries. And they were really interested, we're in this era of global health essentially being defunded. And they're interested in ensuring that all of their efforts are really aligned in order to maximize the impact that they're having in the world, but also to come up with innovative new strategies to really ensure that palliative care is understood as a human right and that it is available for people everywhere. And really to help people understand that, preventable suffering, or that suffering is preventable. And so we helped facilitate, myself and my colleague at 𝗵𝗲𝗹𝗵𝘁 helped facilitate this group of about 30 professionals to come up with some innovative new concepts that they're now really excited to move forward into the world. Everything from communication strategies to new funding platforms, new ways for ministries of health to resource professionals at the country level to do this work, and new ways for information to transfer in between this network of palliative care professionals. So it's just one example of helping groups. I used to do a lot more frontline program design and implementation in my past as a global health professional, designer, program implementer. These days, I'm like one step removed and helping people that are at the front lines do their work better, either through strategy alignment or through actually helping design and engineer ways in which compassion can flow more easily throughout a health system.
That's great. Athena, anything you'd like to respond to what Heather said? And then after that, if you'd like to tell us a powerful story, how you got interested in health equity.
Yeah, I love the work that you're doing, Heather. That's really exciting. And palliative care is such an important thing globally. I uh, went into medical school because of an interest in global health and a passion for listening to these communities in low resource settings
Mhm.
and creating systems that work for them. So in my global health trainings, have come across a lot of palliative care providers and speaking with them about alleviating suffering in these areas is such important work.
Mhm.
So, yeah, and it's so important to rethink how we're going about um, getting funding and like building these networks. So a lot of the times we go towards what we already know and what has already been done,
Yeah.
and those are well-worn paths that perhaps aren't working for us anymore, or maybe never did work really. A lot of times those paths too aren't centered on humans. Um,
Yeah.
and so we need to rethink how can we create networks and systems that are really centered on the people that we're caring for.
Yeah.
And that ripples out to the people that are doing the caring as well.
Amen.
Yeah, so it's
Yeah.
really important. I love what you're doing with 𝗵𝗲𝗹𝗵𝘁. So
Thank you. Yeah, I couldn't agree with you more.
Yeah. So Heather, anything you'd like to say in response to what Athena said? And also, if you have a powerful story to share, how you got an interest in global health.
I mean, I would just underscore everything that you shared, Athena. We brought some new approaches, human-centered design approaches, to this group of palliative care providers. And for many of them, they had not embraced design thinking approaches in the past. And to what you said about, these well-worn paths in our heads. I have a public health background. I actually trained at the University of Washington. I don't know where you did your training, out there in Seattle. But we're really asking a lot of people to embrace new approaches. And, someone said, well, this feels like building the plane while flying it. And we said, no, no, I know it feels like that because these are new grooves that we're starting to, new tracks that we're laying down in the brain. But actually, these design focused approaches, as you're saying, center the end users, the humans, in this approach. But also it's about testing these approaches. It's like testing all of the parts for the plane before putting it into the air. And so by the time that we actually, take flight or, set these new initiatives into motion, we already have a lot of testing data that's been iterated several times. It's already gotten feedback from real world end users. And so we can de-risk it for the funders. We can de-risk these new program approaches for funders who may be interested in funding innovations. But again, we're working in this landscape where funding has to be used really wisely right now because there is just less. There was already not enough to go around, and now there's even less. And so how do we ensure that we're good stewards of the resources that are at play? And design-centered approaches can really make people, funders, confident because we have that user testing data, because it's already designed and fit for purpose around those end users. So it takes a little bit of discomfort. I mean, just like exercise, when you start exercising for the first time, your muscles aren't used to it and you're screaming out like, oh my God, this feels uncomfortable. But similarly with program approaches and design approaches, like we have to get a little bit uncomfortable in order to do something that's ultimately going to build that musculature to do things better, for us to be stronger as a discipline, whether that's palliative care or global health more broadly.
Heather, could you share a specific real life example for people that might not be familiar with your work, something that they could relate to?
Yes, in terms of building compassionate organizations or
Or like how what the work that you did in Dublin, like what is one of the real life examples of what you actually did or what people took
yeah.
away from that to move forward?
Yeah, absolutely. So one of these strategies that one of the concepts that we broke into four groups, this group of 30, and each group had a different strategic initiative that they were trying to address. And the one that I led, I actually have it right here on my desk. The one that I led was centered around creating a unified and amplified global voice. And so this is really thinking about how do we communicate the value of palliative care. And this group, I just facilitated their own ideas around this. And we led them through a series of, workshops, worksheets, and exercises to help them ideate new ideas about how they might embrace this, helping them reframe the problem, helping them think through, what is the strategic priority? How do we get really focused on how to articulate that? So, they're able to then articulate, well, we want to create a universal understanding of the value of care that reduces preventable suffering. We help them think through, well, who's the audience for this message? We could be targeting policymakers, we could be targeting funders, we could be targeting the end users of these services. So one of the ones that they chose to focus on was the end user. But interestingly, their route to get there was by focusing on communicators of the value of palliative care. There are communicators woven in many global health programs. And so what they decided to do is to create an award for the best examples of how to communicate the value of palliative care. And they gave it a name, the Sicilies, which is an homage to kind of one of the original founders of palliative care. And the Sicilies, and what was the tagline? Reducing preventable suffering one story at a time. So it was all about highlighting the really powerful stories about that value of palliative care. And their idea is that if we help people understand palliative care better and help to address some of the misconceptions around it, that, oh, palliative care is, it, for many people, there's a bias that, oh, it means that we've given up, that it's now we're transitioning to end of life care, that there's nothing left that can be done. And they're trying to reframe this around preventable suffering, because there's a lot of palliative care that goes into helping support people who may not necessarily be end of life, but who are dealing with debilitating illness. And so their idea was that if we help people understand palliative care, they're going to demand more of it. More healthcare workers are going to want to specialize and train in it. It's going to be prioritized by ministries of health and integrated into their strategies, et cetera, et cetera. So this award was a way to draw recognition and attention towards those messages around palliative care and hopefully help promote a flourishing of kind of this sub-discipline within the broader palliative care space.
That's terrific. I worked in nursing homes for 7 years, so I can fully appreciate all of that. Athena, whatever you'd like to add, and then if you'd like to share a little more about your work with Zena.
Yeah, I think that's really powerful work to be helping these organizations to flourish. So really vital organizations. So yeah, I think those are all important questions to be asking as we're developing programs and new initiatives to really understand what our mission is and who we're speaking to. So
Mhm.
yeah, that's great. Thank you.
And tell us a little more about 𝗪𝗪.
Yeah, so 𝗪𝗪 is a platform to network healthcare workers and people in the community so that we can work together to shift our healthcare system on a foundational level.
Mhm.
Our mission is to listen to our communities and to create a system that is centered on the humans that we're caring for. So I wanted to bring together people from all walks of life. We need to hear everyone's voices and to really amplify people's gifts and skills. There are so many people that aren't in healthcare that have really important perspectives that we need to listen to. And oftentimes they have skills that would be so important in some of these initiatives that we want to bring out into our communities. So we're going to be working on different projects that are amplifying our community's voices, and they are modeled after programs that are already working out there. So there's some really amazing programs that we can learn from and replicate or, take different aspects of what they're doing and bring them into other communities and scale them outward. So, yeah.
That's great. Heather, anything you'd like to add? And then this show is called Stand Up for Doctors. So I'd like you to speak to why doctors should be interested in your work.
Athena, I think that sounds like an amazing initiative. I think focusing on fostering connection, human connection in healthcare is one of the most important and potentially transformative things that we can be focusing on right now, whether that's in the US or globally. I've done a lot of thinking and writing about this. If anyone's interested, you can go to my Substack, Healing Healthcare. But I feel like we have so sidelined our our natural human ability to care for one another. There's no code for human connectivity or connection that you can bill in healthcare. And when we sideline that, we're just not able to heal in the same way. We have really a system that it's a cure-based system. We want to throw pills at things in order to make the physical symptoms go away. And that helps uh, to a certain degree. But if we've sidelined the most human aspects of healing, which in my mind is connection, we even have, the now recently former Surgeon General wrote a whole book about the epidemic of loneliness in this country. And we've also like systematically engineered it out of healthcare. And if we're not able to really facilitate and focus on that human piece of healing, the connection, the compassion. Um, I mean, you're seeing the results of it. We have a really broken healthcare system. We have a population. I'm a population health person. By many, many metrics, you can say that the United States is getting sicker, right? Our maternal mortality is increasing. We have like alarming rates of mental illness among healthcare providers. And if we have made our care provider, we call them care providers, but they're, like just arms of the pharmaceutical system that are doling pills out to people. And if we've made them so sick, how can they show up for patients with their full humanity? How can they be fully present to the suffering when they themselves are screaming inside because they are not cared for? So it's a product of the system. And I guess this is a segue to your question, Kim. We need to resource those frontline providers. And we need to do that with a systems lens. We can't just show up and kind of point our fingers at that frontline provider and say, you need to be more compassionate, you need to take care of yourself and, really focus on your well-being when it's the system when it is such an epidemic, you need to think about how this system can really create a container for flourishing for everyone that is in it, right? This isn't just a provider problem about being nicer to patients or, being more compassionate. So we have to think about how to create the conditions for everyone in the health system to flourish, to feel cared for, to feel like they have space to feel, really. We're asking providers to like tamp down all of these emotions that arise. Oh, have empathetic distance from your patients. No, actually, what we're in doing that, in training physicians, I'd be curious to your thoughts on this. In training physicians not to feel, we're asking them to not be human, and that's creating more of that disconnect. What is sometimes called compassion fatigue, which is such a misnomer, really, um, because compassion is a renewable resource if it's attended to. It's asking people to be inhuman, to say, I'm not feeling these emotions on the inside. I have to present this calm and this presence on the outside and pretend that I'm not feeling these things on the inside. That's causing this emotional dissonance that is creating, what I see as some of the foundational cracks in our health system. So there's so much more I could say, but I'll stop there for a moment.
Yeah, absolutely. I love what you said, Heather. It is a systems issue. It's not an individual problem. And I think some of these wellness workshops and things like that are kind of a slap in the face in a way, and it's really just a band-aid
Yeah.
for a much deeper issue of not having a system that is caring for humans. I think a big part of burnout and compassion fatigue is providers feeling like they aren't able to provide the care that they really want to provide.
Mhm.
They feel like they came into this field to really help people, and the system is getting in the way of that. And
Yes.
so it feels really hard to be seeing person after person and just offering them band-aids when you know there are deeper issues there, but you don't have the time. The system doesn't offer you the resources. You're not
Mhm.
able to give them the deeper care that you know that they need. And so you just keep seeing them with the same problems and perhaps even spiraling to get even sicker over time. And so that's really hard for providers. I think if we have had a system that really aligned with our values and our purpose as to why we came into healthcare, then we wouldn't see burnout. There might be some people that are a little overworked, but oftentimes we feel like we want to put so much energy into something that feels meaningful, where we're really making a difference. And
Mhm.
so, yeah, I think that's what we want to do in Xena is to shift our healthcare system to one that feels really purposeful, where
Yeah.
we're truly making an impact in people's lives.
Yeah.
I love that because impact is my word of the year. So
Yes.
I love that you said that. Three words that are standing out for me is burnout, moral injury, and resilience. So
Mhm.
some doctors don't like to say burnout because they feel like it's putting the blame on the individual. When, as you both are sharing, and we all know it really is a systems issue. But like any doctor or anybody can get burnout in any job. I was a physical therapist, and when I got burnout in some of my jobs, and I left and I took a new job, that's a lot more difficult for many reasons for physicians. So moral injury is really a little what you were speaking to, Athena, when you can't do what you know is best for the patient. There could be many examples of that. So I feel like there's a different because some people think, well, you shouldn't call it burnout at all, but some doctors could be burnt out, right? Like that is different than moral injury, which is that like internal dilemma where you're prevented from doing what you want to do, or you can't get them their prior authorization or their surgery or their medication, things like that. And then resilience, sometimes they also don't like that word because they're like, again, putting it on the individual instead of the system and saying, well, you just need to be more resilient, when physicians are some of the most resilient people on the planet. But that also doesn't mean that you can do things to shore up that resilience really is moving through a challenging time and coming out a bit stronger on the other side. I've had a conversation with Wayne Sotil, and he has a center for resilience, for physicians. So I think it's important when we're talking about these words is we don't have to throw those words out. We just have to make clear, what we're really meaning when we talk about it. So what are some of the answers, Heather? What can we all do? Anyone listening to hear? What are some next steps here?
Well, I am a huge compassion advocate, and the science has shown that compassion cultivation is an antidote to burnout. And again, I like to bring people's attention back to the fact that compassion fatigue is a real misnomer. It's more about empathic distress is usually what people are feeling, or moral injury is what people are feeling when they go to that word compassion, for that phrase compassion fatigue. And so compassion cultivation in my mind is one of the most underutilized strategies to address burnout and to address moral distress. Um, and again, there are lots of great training programs out there for individuals to work on it themselves. But I also like to talk about the fact that it's really difficult to put a transformed person back into an untransformed system.
Mhm.
And so I also caution people a little bit. It's a little bit like red pilling people. You go back, you're like, oh my gosh, I didn't realize exactly how this was all working. But I don't know what to do about it any deeper than just what I've learned for individual strategies. And so what I see as necessary is not just offering, the Calm app for, physicians to do a little mindfulness meditation. It'll help. It will help. But I think we need to look at how do we engineer compassion? How do we design the system to for compassion to flow freely? And so at 𝗵𝗲, we have developed something called compassion mapping that we do. And we use a variety of different activities and strategies to elicit this, but it's kind of like an organizational compassion angiogram. We're able to begin to identify where are there blockages in the system, where are things flowing freely, how might we replicate, where this compassion is really exemplary, how might we replicate that in other parts of the system? If we are identifying blockages and barriers, what do we need? What kind of stent is appropriate to put in that part of the system in order to facilitate that flow of compassion? Because I would argue, Athena, you just spoke to this, like physicians, any of us in the healing professions, and I consider myself one of those people, even though I'm a public health person, we come to this out of a deep sense of compassion, and then we don't attend to that, right? We're asked to act as machines in this system. And if we don't attend to that original motivation, then we begin to get cynical, get burnt out. We're just commiserating amongst other people who we know are experiencing these same distresses. Well, if we can begin to build the scaffolding, the architecture for compassion, for it to continually be this renewable resource that it is at a systems level, then we're able to draw on that continuously. And it doesn't we don't just deplete the well. So it's about finding it. Where do we tap into that aquifer of compassion? Because in my view, we are all innately born with this capacity for compassion. And there's superheroes in medicine. Those are the Olympians of compassion. And so even though they're compassionate exemplars, we still need to resource them. Olympians, to draw on that analogy, have tons of raw talent, but they still need to train. In the same way, physicians and frontline providers and social workers and public health people are the compassion Olympians of the world. They still need to train. We still need to ensure they have the conditions to succeed and to ensure that that resource is put to good use and can be continuously drawn upon.
Yeah, that's a beautiful analogy. I love that so much. Yeah, it really does need to be nurtured and supported within the system, and to be something that's part of the system, which currently it feels really depleting in the system. when I did a global health fellowship in Rwanda, I really got to see what our healthcare system is and what it's doing.
Yeah.
We in global health tend to push our healthcare system on these communities and as a way of helping them. It comes from good intentions, but it causes so much harm because our system is really expensive. It's
Mhm.
really disconnected from the community, and it's has the hierarchical uh, structure that creates a lot of disempowerment to nurses as well as to patients, where they feel a sense of helplessness and powerlessness within the system. And I seeing that how we were training these local Rwandan doctors to be elitist, to wear their white coats, to have, stand over their patient and be disconnected. It was just like, wow, this is what we're doing in healthcare. And I realize on coming back to the States that we're doing the same thing here. We're pushing a one size fits all healthcare system on our communities, and we're not really listening to them.
Mhm.
We have all this hierarchy, and yeah, so seeing that in its starkness really woke me up. And like you said, it's like taking the red pill, and it's really hard to continue to work within the system.
Yeah.
And I felt very isolated, like, there's only so much I can do on my own. And a lot of people didn't really see the issues that I was seeing, but they felt a sense of, like they didn't like the system, but a lot of people didn't really understand what the issues were. But there are a lot of people that do see that and that really want to advocate for change in the system. So
Mhm.
us coming together and having that connection, building something that feels like it is really supporting our compassion and supporting that connection. Uh, that's where we need to work together towards. So
Yeah. Yeah.
yeah.
Absolutely. And what's coming to me is, I mean, the problem, particularly in the US, it feels so intractable. It just feels like this impossible thing to, impossible cruise ship to, turn and steer in a different direction. And I just always come back to, there's a Buddhist proverb, and I'm not going to get it entirely correct, but the sense of it is like tending to our part of the garden. And I think it's moments like this and people like Kim pulling together folks, these points of light, and realizing that we are a community that desires transformation, and realizing that we aren't alone. There are so many of us. And if we're all like doing little bits in our little corners of the garden, and maybe if there's people like Heather who can help facilitate, a harmonization of all of these efforts, and if we're able to begin to align and move in a new direction and really envision a new future together. I guess I would say that's another thing that I think is really important. I feel like so much of the efforts that are happening right now in healthcare in the US, really globally, are reactive to the ills that we're experiencing currently. And that is important, but we need to create space to vision a new future. If we're always looking backwards here and trying to like fix the things that went wrong, we don't have the space to look forward and say, well, what is it we actually want to create in the world? And how do we orient all of us towards that? Because there's going to be a gap in between these two areas if we don't create that space, and if we don't make the time and create efforts to harmonize our vision for the future. I mean, I think about Bloomberg and his efforts to, I mean, he envisioned it was either like a 15 or 20-year time horizon for a smoke-free future, right? And look at where we are now. If nobody had sort of, put their flag in the sand and said, this is where we're heading, we just would have been, doing little tweaks over here about how to make cigarettes perhaps, a little less harmful. And instead, somebody articulated a big new vision and coordinated efforts to go there. And so that's, I feel like we're in a boat. We all have our, I told you I'm a nature person and I love canoeing in the northern Minnesota wilderness. I feel like there's a bunch of us in the canoe. We all have our paddles in the water, but nobody has a map and nobody has a compass. And I would love to see this community come together. And I think we're beginning to see that flywheel pick up through HRC, through some of these efforts, Kim, like this podcast that you host. And I think we're beginning to feel some momentum and feel some alignment begin to emerge, but we have to articulate that new vision for the future.
I think so, and Todd Otten would call it, ripples of change, and the ripples are
Yeah,
going to turn to waves to a tsunami. And I'm
absolutely.
really sorry that we have to end this conversation. I'm going to have you both send me the links, how our listeners can get in touch with you after this episode, and I'll put those in the show notes. And I love it when you're talking about listening, compassion, kindness, and that doesn't have to cost anything. We don't have to wait for the system to change, and it will change if we find ways to start doing that, right? Listening to each other, have kindness and compassion for each other, and you don't have to wait. So that would be a great take home message. So thanks again for being my guest today, Athena and Heather. I can't wait to publish this episode.
It was a
Thank you
pleasure.
so
Thanks
much.
so much, Kim. Great to meet you, Athena.
So wonderful meeting you, Heather. Yeah, thank you so much, Kim.
You're welcome. So, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So, stand up, doctors, and let's stand up for doctors.